Thank you, everyone. Thank you for your patience. Welcome. Uh, and thank you for making the time to join us tonight for this informational session on the scholarship program for the Latin American School of Medicine in Cuba. I am Dr. Samira Mifatu Adri, and I am the program coordinator for this scholarship offered by the Cuban government and run by IFCO Passes for Peace, based in New York City, New York. I'm a proud 2020 graduate of the Latin American School of Medicine, and it will be my pleasure to share information about this incredible opportunity with you all. Next slide, please. Okay, so it says here, we are prepared to grant a number of scholarships to poor youth who cannot afford to pay the $200,000 it costs to get a medical degree in the United States. Those are the words of an educated leader, President Fidel Castro, in September of 2000 at Riverside Church in New York City. He was well aware of the precarious situation that faces young people from poor and marginalized communities across the U.S. Since President Castro made that offer, the cost of medical school has gone up, and the average is now about $300,000. And that is only focusing on the 4-year training that many students have to struggle to get in this system. Many of our youth don't have the support, guidance, and knowledge to pursue medicine, and the real cost is more than $300,000. Shall we delve into the real cost for underrepresented groups? I'm not sure there is a graph that puts those elements up for consideration. You may be aware that the root cause of disparities when it comes to representation for people of low socioeconomic status and people of color is institutional and structural racism. But do not despair. For a century-long crisis, there is a solution from a place that is least expected by some, but renowned by others, Cuba. So, ELAM, as it's known in its Spanish abbreviation, was founded on November 16, 1999, as a long-term solution for the devastating effects of poverty and the resultant weak or non-existent health infrastructure in underdeveloped countries of the world. It all started after Hurricanes Mitch and George ravaged parts of the Caribbean and Central America, causing a death toll of thousands and displacing over 1 million people from their homes. Cuba sent health workers to help those vulnerable populations, and within a short while, they realized that many of the people they were working with never had any medical care. The Cubans realized the help being offered would expire within a short time, and there was a need to answer the greater problem at hand, the lack of health infrastructure in the most vulnerable populations in the Caribbean, Central, and South America. So the Cubans transformed a naval base into an international medical school to accomplish the mission of training physicians for disadvantaged communities all over the world. This idea of tackling health inequities in a structural way goes back to the influence that social medicine had in Latin America. Rudolf Virchow was a German physician whose contributions led to the creation of social medicine, and he was an advocate for the idea that root causes of disease and lack of health were social inequalities. He is noted for having said that, quote, medicine is a social science, and politics is nothing but medicine on a large scale. Medicine, as a social science, as the science of human beings, has the obligation to point out problems and to attempt their theoretical solution. The politician, the practical anthropologist, must find the means for their actual solution. Science for its own sake usually means nothing more than science for the sake of the people who happen to be pursuing it. Knowledge, which is unable to support action, is not genuine. And how unsure is activity without understanding? If medicine is to fulfill her great task, then she must enter the political and social life. The physicians are the natural attorneys of the poor, and the social problems should largely be solved by them. End quote. Some of his students and followers would later lead medical institutions across Latin America. And it's one of the first lessons we get in our education, in our introduction to medicine at ELAM. Next, this slide. So people often wonder how it ended up that U.S. citizens should study at ELAM, given the tense relations between the U.S. and Cuba. After the school was founded in 1999, a year later, members of the Congressional Black Caucus of the United States House of Representatives visited Cuba on a tour led by Reverend Lucius Walker, the founder of IFCO Pastors for Peace. They were impressed by the achievements of the Cuban healthcare system and ELAM, so they requested medical school scholarships for U.S. students. Well, later that year, President Castro visited Harlem and announced the offer of scholarships to youth from the U.S. In 2001, IFCO Pastors for Peace accepted the responsibility of administering the scholarships to U.S. students. And then the first group of U.S. students began their medical studies. That first group graduated in 2007, and many of them later served in the Henry Reef Disaster Medical Brigade, joining Cuban doctors caring for victims of the 2010 Haitian earthquake. As of 2022, 220 physicians from the U.S. have graduated from ELAM and returned to their communities. You will find them working in various sectors in the U.S. healthcare system. Next slide, please. So, the mission of ELAM is to train doctors of science and conscience. We are physicians that are proudly part of the Ejército de las Batas Blancas. In English, that's the White Coat Army. President Fidel Castro explained the vision of the school when he said, "What we want from the Latin American School of Medicine is for students from our sister nations to become imbued with the same doctrine in which our own doctors are educated. With that total devotion to the noble profession, to the noble future profession, for a doctor is like a shepherd, a priest, a missionary, a crusader for the people's health and physical, mental well-being." So there's a link on this that we can't show right now, but it's a video that's created by the school in 2019, and it tells you about ELAM. It's in Spanish, there's no subtitles, but just imagine not knowing any Spanish and feeling lost watching this video. But by the end of your first year studying in Cuba, you can understand almost everything that is said in that video. So I encourage you all to follow up and watch that. We will share that in the chat during the Q&A so that you can access that. Next slide, please. So what type of education do you get at ELAM? It's a unique educational experience. You get a well-rounded education, and you study in an educational environment that focuses on collaborative learning. The education is holistic from start to finish, where you learn about the biopsychosocial model, which is seeing your patient as a whole person. The biopsychosocial model emphasizes the importance of understanding human health and illness in its fullest context. The biopsychosocial approach systematically considers biological, psychological, and social factors and their complex interactions in understanding health, illness, and healthcare delivery. Studying in the Cuban classroom requires collaboration rather than the cutthroat competitive culture groomed in pre-med and medical learning environments in the US. For example, a student who is struggling in a Cuban classroom and a student who is excelling in a Cuban classroom has to follow this paradigm of compañerismo. This is where the Cuban profe tells the one that's excelling that he or whoever they are need to help the one that is struggling, and that if their compañero, their classmate, is struggling and failing in that subject, it is the duty of everyone to help that student pull themselves up and to improve. And so the student who excels naturally then develops this concern and this solidarity with their other compañeros, with their other classmates, that hopefully everyone will succeed in the classroom. That's a collaborative learning that we thrive in at ELAM. Next slide, please. Oh, wait, hold on 1 second. Also, the other aspect of this education is that the emphasis of ELAM training is based on the strengths of the Cuban healthcare system, which is a primary care focused and oriented by community medicine. You receive public health training, and it makes you well prepared upon finishing your studies. The picture on this slide shows medical students with a professor and patient during rounds, doing the physical examination of the patient, which in Cuban medicine is key to diagnosis. It requires taking time to understand why the patient is sick and then supplementing the physical exam with lab tests and other diagnostic tests to corroborate the clinical findings. Typical of rounds during the clinical years, you are taught about the importance of learning at the bedside of the patient. And throughout your time, you also learn the importance of learning in the community of the patient from the work of the community nurse and doctor. Next slide, please. So in 23 years, ELAM has graduated 220 physicians from the US and 30,644 physicians to serve the world. These students are predominantly students of color, representing 120 countries in North and South America, the Caribbean, Africa, Europe, Asia, and Oceania regions. Most students are first generation university and professional students. This beautiful quote by Dr. Margaret Chan, former Director General of the World Health Organization, came when she visited ELAM. And she said, I know of no other medical school that offers students so much at no charge. I know of no other medical school with an admissions policy that gives first priority to candidates who come from poor communities and know firsthand what it means to live without access to essential medical care. For once, if you are poor, female, or from an indigenous population, you have a distinct advantage. This is an institutional ethic that makes this medical school unique. End quote. Next slide, please. So, what is required for this scholarship? Well, one, you need to be a United States citizen. You need to be a high school graduate. You need to be proficient in college level sciences with a minimum of a B average in 2 semesters of the following classes: biology with its lab, general chemistry with its lab, physics with its lab, organic chemistry with its lab. And you also need to be between the ages of 18 and 25 years at the time of application. But last but not least, you need to be committed to practicing medicine in poor and underserved communities in the United States after graduation. It's important to know that the deadline this year for the application is July 1st, 2023, and we urge everyone to request an application if you meet the criteria at our website, www.ifconews.org. Next slide, please. What is covered in the scholarship? The scholarship covers tuition and fees, uh, dormitory room and board, meals, school supplies, uniforms, textbooks in Spanish, and a modest monthly stipend. What's not covered is your airfare and travel expenses to Cuba and personal expenses. And also, it's important to note that students cannot work while studying. In that context, in Cuba, it's unnatural for a student to be working and studying, um, unlike here, where we find happens a lot, where students are in medical school and still juggling jobs while studying. Next slide. So, what is covered in the curriculum? It's important to note also that this is a longer program than most people are used to, but when you actually do the comparison, it's pretty much the same if you stayed in the States to study. Because in the States, you would have 4 years of an undergraduate degree and then apply to medical school, which would be another 4 years. So that would be 8 years total. Whereas this program is 7 years, and the 7 years is including a year of learning Spanish. So the real uh, term of medical school is actually 6 years, but because you have to learn Spanish, is an additional year, making it 7. So in that first year that you go in, it's called the pre-med year. This is where you get language and basic pre-medical coursework. The school provides 2 semesters of intensive Spanish language program with fundamental to intermediate level preparation as well as medical Spanish. Again, it's not a requirement for you to know Spanish before you start the program. Many of are students who enter the school coming from all over the world, have never spoken Spanish before. So this preliminary coursework of teaching Spanish is to set the an equal level playing ground. What's the term? A level playing field for everyone to be able to thrive in Spanish, to learn Spanish and thrive. Um, then we have a first and second year being your preclinical years. Basic medical sciences are taught during these years. This is everything from biochemistry, molecular bio, histology, anatomy and physiology, pharmacology, genetics, your introduction to public health and comprehensive general medicine, which is a particular type of family medicine in Cuba, physical education, and yes, that is PE because sports is part of life and health. And so, as physicians, we have to learn to be fit, right? And you also get biomedical statistics, history and medicine, and much more. Then your third, fourth, and fifth years are your clinical years. This is where you will be full time in a hospital, starting with a year of internal medicine, then delving into uh, surgery, obstetrics and gynecology, pediatrics, public health again, psychiatry, urology, forensic medicine, disaster medicine, traditional and herbal medicine, all of these things, which I'm pretty sure if you were here, you might have to take as an elective. But this is built into the curriculum in Cuba. And your sixth year is actually a rotational internship year. So whereas in the States, your intern year is the beginning of your residency, uh, our intern year is the final year of our studies. So this is where we rotate again in the core specialties of internal medicine, general surgery, obstetrics and gynecology, and pediatrics. And here we are junior doctors under the supervision of attendings, and managing and taking care of the patients that were assigned. And upon completion of this year, you have to sit for a final Cuban national exam known as the Estatal. And when you pass that exam, then you are conferred the degree of doctor in medicine. So, bringing humanism to the core of medical practice. Here we have our U.S. ELAM graduate, Dr. Lillian Burnett, sharing that Cubans would say there's a role the physician has to play around addressing gun violence in the community, around addressing addiction in the community, addressing police brutality in the community, she continues. Those are things that people are dying from. Even if there's not a pill for them, you need to understand the impact that all those other social, political, economic stressors have on someone developing an infectious disease or diabetes or hypertension in that atmosphere. There's medicine in that too. You have a responsibility in that too. This goes to show what I've been saying earlier about the comprehensive approach to medicine that we are taught in Cuba, how to see the person as a part of his environment, as a part of his community, as a part of a family, and as part of society, and all the ways in which those relationships affect that individual. And for us in the US context, the elements that Dr. Burnett mentioned very much do affect our health, and affect the manifestation of physical illness in us. So, as a community doctor, you think about these things when you're taking care of your patient, and that's something we cannot buy. It's one of the beautiful aspects of having studied in Cuba is this realization that we come to. So there are some additional considerations that we have to make when we talk about studying at ELAM and then coming back to the United States in terms of U.S. medical recertification. Um, the goal of ELAM is to train global medical personnel. Graduates from every country have to reintegrate into their home country's health system, requiring extra steps. Returning to the U.S. means doing extra work required by the U.S. licensing and graduate medical education systems. U.S. medical students, whether they study here or abroad, all have to take the United States medical licensing exams to apply for medical residency and practice medicine in the U.S. So this picture you see is a map of the United States, and it shows where currently U.S. ELAM grads are working. They are in the dark blue. You have the states where grads are working, and in the light blue, you have states where U.S. grads are not working. And some of those also coincide with states where we have not had students uh, apply from. So we still have a lot of ground to cover, especially in some critical areas where there's a lot of rural population to take care of. Next slide. So, what are these USMLE STEP exams? United States citizens who have studied abroad are considered international medical graduates, IMGs, and are required to take the same licensing exams as medical students who have studied in the United States. All medical students in the U.S. must take the United States medical licensing exams, the USMLE. Currently, it is a three-part process that includes taking USMLE Step 1, Step 2 CK, an occupational English test. Yes, although we are native English speakers, we are required to take this test, and applying to a pathway for clinical evaluation. The Educational Commission for Foreign Medical Graduates, ECFMG, is the entity responsible for certification of all medical students who have studied abroad and want to be incorporated into the United States healthcare system. This is an unprecedented offer and its extraordinary history. Cuba comparte lo que tiene, no lo que sobra. That is a saying in Spanish. It's translated in English as Cuba shares what it has, not what is left over. So maybe you don't know much about Cuba, but choosing to study at ELAM requires learning the history of U.S. Cuba relations, especially regarding the U.S. government's cruel blockade of the island, assessment of your knowledge about Cuba's success in the face of 60 plus years of siege, learning about the current struggles facing Cuba, and at the end of the day, the calling to be a Cuban trained physician will need you to adapt to many challenges if this is the path you choose. Yes, making humanity the priority. It is true that despite difficulties, Cuban medical internationalism continues to be a cornerstone. ELAM is a part of a long history of service and solidarity by the Cuban government. The Henry Reef Brigade was created from a spirit of solidarity and has served in over 55 countries in response to disasters. Cuba offers hope for many people globally. In 2005, after Hurricane Katrina devastated New Orleans and other cities in the United States, Cuba offered to send a medical brigade to help on the ground, and the Bush administration refused that helping hand. Cuba continues to set the example. To date, it is a system that has free universal health care. It is a primary care centered and preventive approach. Um, there's a high doctor to patient ratio, as evidenced by this graph that you see on this slide. Um, Cuba's outranking countries like Switzerland, Germany, Sweden, Australia, the United States in its doctor to patient ratio. It has a higher life expectancy than the US, especially now after the pandemic happened. US life expectancy dropped, where Cuba remained uh, pretty high. I want to say it's 78 right now, and US dropped to 76. Um, so there are fruits of the labor that they've been making over the years in creating a healthcare system that is human centered, that's people centered, also contributes to things like a low infant mortality. Now, I do want to say that infant mortality before the pandemic was around 4 for Cuba, but during the pandemic, there were huge, huge struggles, and It has gone back up, unfortunately. But if you delve into it and you look up information, you'll see why that happened. Cuba was and continues to be under severe stress due to the blockade and everything else that happened as a consequence of the pandemic. So the infant mortality rate has gone up a little, but it is still something to be admired and applauded, especially for a small island country, and particularly at the rate that they are saving babies' lives, it's much higher than the rest of the region. So we should definitely learn from Cuba's example. During the pandemic, Cuba also developed 5 COVID-19 vaccine candidates. Those are what you see in the second picture. Three of them have been successfully used to vaccinate 95% of the eligible population in Cuba. And aside from that, not only vaccinating their own population, they've sent thousands and thousands of vaccines to other countries that requested them in order to help curb the spread of COVID-19. So we can learn from Cuba and help U.S. communities. In a report released by the Association of American Medical Colleges, AAMC, the United States will experience a shortage of up to 124,000 physicians by 2034. That's just around the corner. If populations that are underserved by the health system had healthcare use patterns similar to populations with fewer access barriers, this shortage increases to 180,400 physicians. Under resourced and underserved communities continue to bear the brunt of the disease burden and an incredible loss of productive years to disabilities and premature death. The ELAM Scholarship Program offers a tremendous opportunity for young people from communities that are underrepresented in medicine in the United States. Cuba has one of the highest doctor to patient ratios in the world, and it continues to share its intellectual resources globally through service and solidarity. U.S. ELAM graduates return to their communities as fully bilingual and culturally competent professionals who have trained in the biopsychosocial perspective and remain dedicated to serving disadvantaged communities. So, to learn more about this beautiful school and its achievements, some essential documentaries are available for free online, like Dare to Dream, Revolutionary Medicine, Community Doctors. We'll share those links in the chat. Um, we also have seen there has been extensive coverage over the years by the media. So, you see links to different media outlets like Breakthrough News, PBS, I think was one of the first ones that I saw when I was applying. That was way back when. But the the news has been out there for whatever reason. The algorithms don't push it forward for people to know that this is a possibility. But that's what we're here about. We're here to inform and spread the word. So it's important to reiterate that the deadline for the scholarship this year is July 1st, 2023. Please check out our website to request an application and follow us on social media. On Instagram, Twitter, Facebook, YouTube, we're there. We have all our handles on the screen. So please stay in touch. And if you have any questions, also email at elamscholarship@ifconews.org. All right, that was great. Um, we will now move to our Q&A section. I don't know if there were any questions in the chat while I was talking.
Hi, Dr. Samira. I have a question.
Hi, Salifu.
Ramadan Kareem.
Ramadan Kareem.
So some of us here are not graduating this year, but we are still very curious about the scholarship. If I'm like a incoming freshman or like a sophomore, like what should I be focused on doing if this is something that I want to do by the time my senior year comes?
Awesome question. Um, this is important because part of my personal story was finding out about this program when I was 15. So I was a sophomore in high school. And what was I going to do? How was I going to get to medical school? I was going to engage with the things that I needed to engage with: sciences, the basic sciences, part of regular curriculum at school. You need to take those classes seriously, your biochemistry, any science that you can get your hands on, especially at an honors and AP level, just to engage with it rigorously and help you prepare for a college level science course. That's number one. Also, volunteering at a clinic or a nursing home or anywhere that you can engage with um, health workers and expose yourself to what it is that it takes to care for a person. I had gotten myself involved in a program that our high school offered, which is called Medical Careers, where you learned medical terminology, and then you also got certified as a nursing assistant. So that was in high school, and by junior year, I was done with that. So I was able to work as a nursing assistant, and also later job was like as a physical therapist assistant. But anything that I could do to engage with the healthcare system and offer care was important to build that stamina, build that relationship with human beings, and the need to learn from patients and to learn from other healthcare workers, especially nursing assistants, EMTs, all the people that unfortunately are disregarded in our system but are very vital to us carrying out the work that we do for healthcare. So those are accessible to high school students. I think more and more now, there are different avenues that are being made available because there's this push for STEM programs and all that. If you want to do research too, that's cool. But again, as a Cuban trained doctor, the approach is to be in the community with the people. So whatever you can do to be by the side of the people, whether it's a food bank, doing whatever it is, that's all part of health and medicine. So that would be my response. I hope that answers that. I think I have
Thank you.
a problem.
Yeah, thank you for putting this together, Doctor. Who would I work at a college that has a allied health focus in Maryland. Who would I talk to about bringing this presentation to our college in a hybrid form?
Me.
Okay, all right.
Yeah, I'll be happy to collaborate with you, and glad to hear you're in Maryland, so that's even better. Um, from here, so we will talk. I will share my information in the chat.
Okay, thank you.
No problem.
Hello. Revolutionary greetings, everyone. Thank you, Dr. Sabir. The presentation was excellent. I just had a question. I have a niece who is 25 this year, and she's interested in medical school. And when I bring this program up to her, one of the areas of resistance is around the training or the degree being accepted once she gets back in the US. So she's always like, well, I hear that like once you come back, it's harder for you to get a job. Or so can you kind of speak to the truth of that, or how I could be able to talk to her about whether that's true or not, once you're trained in Cuba, you come back to the US getting a job.
Okay. Right on. Thank you. And I'm sorry, your handle says Brother Muniga's name, but I want to address you correctly. So what's your name?
Brother Bonika invited me, so I came on his link. I'm Zenzele.
Okay. Thank you, Sister Zenzele, for the question. Yes, it is very important for us to share that as graduates of this program coming back into the system, of course there are challenges, but it's not challenges. They're not challenges that are unique to ELAM trained doctors. These are challenges that happen to any international medical graduate, because the system is set up where we have to come back. Um, and we have to have taken the same exams as US medical graduates, knowing that our curriculum has been different for 6 7 years, right? The Cuban curriculum is different to a large extent, and even though we are trained to heal the world, here we are. We now have to crunch information according to uh, the methods that the U.S. system requires us to learn, um, and that is something that cannot be underestimated. Right now, I can say that um, over the years, it's been inspiring to see the level of work that graduates have put into establishing a network and a system of being able to study for those exams while you're in Cuba, thereby increasing the number of students who are able to take those exams while they're studying and then be pretty much done with them by the time they graduate, so that it will limit the time, the gap between graduating and entering residency here. It's important to state that regardless of the fact that we studied in Spanish for all 7 years and now we have to study for these USMLE exams that I mentioned in the presentation, we still do it, and we do it very well. And compared to other international medical graduates who match into residency at about a 50% rate, we match at a rate of about 88% into residency, because we're coming with an arsenal of resources and skills that are not easily found here. You're talking about a US graduate who becomes professionally fluent in Spanish, who is able to reach a lot of a population that is very hard for a US medical graduate or somebody who can't express themselves in multiple languages to reach. That's one thing. Cultural competency, because we've lived amongst our comrades and friends from all over the world. We've learned to be humble and respect and center the people that we are taking care of, which goes a long way in reaching populations that are under resourced and underrepresented. And then we're also coming from this, again, approach of looking at a person in their whole context. Um, it's very hard to put all of those things in in a way that this system wants to appreciate people by stats and by exam scores. Those things are a very narrow way of analyzing the worth and the value of a healthcare professional, right? But as a U.S. ELAM graduate, I can say that I'm proud uh, of the work that people have done. It has been hard to lay the ground because nothing here in this system is welcoming to an outsider. You have to forge that path, and they have for the 15 years that we've had graduates. They forged a path for us to be able to go there, study, and come out being able to get into the system. This week we had a process that's called the match. Not this week, last week. Last week was the match, the national match, which is a time where people are placed at residency programs throughout the country. And again, we had success rates of our graduates matching into residency programs. And we also have information about where our graduates have placed in the past. All those places have then become places where ELAM graduates are welcome, because once we get in the door, once we get there, our reputation is then known, and it builds a pipeline for other people to continue their training. That's why we've been able to train and work in all those different states that you've seen on our presentation. So the work is continuous. It's a revolution in progress. But we're working at it every day. So please encourage your niece to hit us up and talk to us, and we will find a way to make her another Cuban trained doctor.
Thank you.
Any other questions? No? Well, I hope that means that the presentation was thorough. But if not, please feel free to reach us by our email. Oh, I see a hand up.
Hello, can you hear me?
Yes.
Hi, how are you?
Fine, thank you.
Thank you so much for a great presentation. I really appreciate all the work that you've done and that you all are doing. I'm here on behalf of my sister. She wasn't able to make it tonight. I sent her some preliminary information, and she studied Spanish pre-med at Spelman College, and so she's fluent in Spanish, and so I was kind of wondering about that. And I know there was an emphasis on like professional Spanish. And so I was wondering about that. I guess I have two questions. And the second one is that she's 28 right now. And so she's like, I'm not sure if I meet the qualifications. And she's also done some post-bac work. So I'm not sure if she actually got a certificate or not. But anyway, so I just wanted to ask some questions on specific to her and see what so yeah, the two where I guess the Spanish requirement, if she already has that, would she have to do that first year? And then the second one, if she's 28, would she still be eligible?
Right on. Thank you. Is it Albie?
Abby, uh-huh.
Abby. Thank you, Abby. Important question, and thank you for being on for your sister. That's real love and support. We can't buy that. So the first part of the question is about the Spanish part. So she has some experience with Spanish. That is good. What happens is that she will be able to take a proficiency exam if she's there in Cuba to see what level she's at. And if it's good enough to just focus on the pre-med basic sciences and Spanish part, then she would be promoted to that section. Instead of doing a full year of Spanish, she would just do the 6 month part of pre-med sciences in Spanish. So that would reinforce her Spanish, but then give her that professional level terminology that you would need from first year through the final year of medicine, right? So that would be the part about Spanish. Then the other question was about her age. It's okay. She's 28. This is what she wants to do. We make exceptions for people up to 30. So she's okay. She's good. If she wants to do this and she can get the other requirements done in time, please tell her to apply.
Thank you so much. I appreciate it. That's all I told her anyway, but I'm glad to ask the question.
No problem. Thank you.
Is it evening? Yeah, I guess it's evening. Good evening, y'all. How's everybody doing?
Good evening, Brother Muniga. We're good. We're good. Good to
Right,
see you.
good. I had one question, and that is the combat the I said the array of lies and falsehoods that become critical in terms of the fear factor. And Nkrumah teaches us the secret to life is to have no fear. Of course, you know, when we talk to parents about their babies, you know, the first thing we get is that, you know, well, I don't want my baby, this, that, and the other. A functional question. The links to the materials that we could use to convince or at least clarify in the minds of parents and certainly the students the benefits of being nurtured in an environment such as ELAM certainly should outweigh the myths, the lies, and put into proper relief and perspective the truth about difficulties that may or may not exist in this process. I'm asking, should we begin the campaign, or I shouldn't say begin, but participate in the campaign by going to these links, taking them to our relatives. Zenzele mentioned her sister, the brother I think that just got off talked about his relative, yeah. So this should be a process that we employ, right? Using what's already packaged and taking it, we'll say like Mao said, let 100 flowers blossom, let 1,000 schools of thought contend. And just putting the information out there and start generating within the community of labor, the community of workers, generate this enthusiasm amongst our young folks and folks who may not be so as young. That's why you said, what, 28 is the cap for application? 25. Okay, yeah. So we go to high school to at least completing your first college degree. Yeah, so that's the question. Is this an effort to recruit?
Yes. First, yes, it is an effort. Second, yes, you should use those links and resources to counter the misinformation. Uh, this is this is a battle. When I was setting this presentation up, I decided to just Google free medical school and see what happens, where we pop up in the algorithm. We are like, I don't know, on what, 100th page or something on the Google Google algorithm. And that's not, it's not it's not by accident. It's not by
Mhm.
accident at all, because what you'll find is that something like this, a resource like this, is being pushed out of the understanding or the awareness of the everyday people who need this kind of a break. And it's incredible. There's information out there to go to all sorts of places to study medicine, but the Cuban one is far away. And it's also because, number one, we are a small nonprofit institution. We do not have the big bucks to pay for Google ads and YouTube ads and all those things that people pay for in order to push their programs out there. And we shouldn't have to, because we are of the people for the people. This is why word of mouth has to, take on its true essence and do the work for us. And that's
Yeah.
why we're happy that you could join us. The links that we've shared are crucial to helping parents and family members become aware of this opportunity and to understand that there's a lot of propaganda against Cuba, but the reality stands that 30,000 plus people being trained in medicine is not anything to be taken lightly in the world. And not only that, it's important now more so than ever, because recently Congressman Menendez and Marco Rubio decided to ramp up their misinformation by trying to put out a bill again about Cuba trafficking its physicians, having physicians in slavery. These are all lies. Our professors at ELAM were many of those physicians who have done and worked in missions throughout the world. And they come back with that arsenal of knowledge that they've learned and they've applied globally to come and teach us to be just as effective as physicians. And they're not in any type of slavery. They actually want to go back to those missions because they loved it so much. So the reality is, we have a job as soldiers in the movement of truth. We have a job, and it's to put it out there and to let people know that this is the way. It may not be the panacea of our problems, but it is a leg up that nobody is giving us here.
Yeah. Samira, this is Gail. Can you hear me?
Yes, ma'am, we can
All
hear you.
right. Yeah, I just want to just give a shout out to our brother Muniga and Salifu and so many others that are on the line, and grateful that you're here. Um, I just want to reiterate one of the things that Samira, who we're blessed to have her, really as our program coordinator for this program, having been through Elon, but also just her sensibilities, her as a young revolutionary. I mean, and bringing that to the table is really critically important. So we want to thank Samira for all that she does. I cannot reiterate how important it is for all of us on this call and beyond, to be talking about this incredible opportunity. Um, I mean, I'm shocked, but I'm not shocked when Samira says, and Googling it, that we don't even show up on the list. given that ELAM has been, one of the premier programs to offer medical school under full scholarship. I mean, it's unique and all for all the reasons that Samira spoke of. But I just want to say it's really important for all of us to help spread the word. Be in touch with us. Be in touch with Samira, with Angie, myself. We can provide materials from brochures to the beautiful action education toolkit that the team just created. We need to get the word out about this program to our communities because we need more and more human trained physicians across the country. And that map that Samira showed, we want to fill in those gaps in the middle of this country. We need an ELAM doc in each and every one of our the U.S. states and beyond. So anyway, just wanted to say, help us to spread the word, help us to get the word out about this opportunity. At a minimum, send people our way or let us know if we can send you some materials that you can make available to people in your own local communities. But thanks for just being here and helping us to spread the important word about this incredible opportunity.
Right on. Thank you so much, Gail. And for those of you who don't know, Gail Walker is the executive director of IFCO Pastors for Peace. She is the continuation of great and revolutionary leadership at IFCO Pastors for Peace and is fully involved with this aspect of the ELAM program, the application process, selecting students. She's always there. And if you have any questions specifically for her, she's available. But you come through Angie and myself first, and then we'll let her know. But so grateful to be on a team that is fully present with this particular struggle. And also on the call we have Reverend Dolamar LeBron, who is the associate director. She may be busy, she's muted, but she's also on the call, and we are grateful for all of you joining us tonight. Hopefully, we'll have a follow up session again in May, so be on the lookout for that. If you do not have our resource toolkit, our recruitment toolkit, please email us so we can send you these resources and you can share them with your networks. Thank you so much.